Hi, my name is Karen Longtin, and my presentation was on increasing cardiovascular health in adults with yoga, with my presentation named Get Hillsboro Moving, Increasing Cardiovascular Health with Yoga. The city of Hillsboro in southeast Ohio is the town that I did my presentation on. It's located at the junction of US Route 52 and 62 and State Route 73, 124, 138, and 247 in Highland County. This is a multiracial, mostly residential community with family neighborhoods. There are two grocery stores, one large retail store, and mostly fast food restaurants that serve the community with banks and other locations for retailing. Hillsboro's population is 6,605 people, with a per capita income of approximately 19,000 per year, with 12.5% living in poverty. 22.4% of residents are aged 45 to 64, and 20% were 65 and older. According to the Highland County Annual Report in 2019, the leading cause of death among adults was cardiovascular disease. And then one of the Healthy People 2020 objectives is to increase overall cardiovascular health. The article, the research article that I used is Guidelines on the Primary Prevention of Cardiovascular Disease, a report of the American College of Cardiology, American Heart Association Task Force on Clinical Practice Guidelines, written by Arnett et al., and it was in the 2019 ACC/AHA guideline. And according to Arnett, the most important way to prevent cardiovascular disease is to promote healthy lifestyle throughout life, preventing cardiovascular events through primordial prevention, which is a prevention of risk factor development, and control of traditional cardiovascular risk factors. When a number of residents, 42.5% of Hillsboro's population is 45 and above, it's difficult to implement healthy lifestyle choices because by that point, we're usually set into what we do every day. Everything's the same. So implementing a whole nother guideline to prevent disease is really hard for older adults. To develop sustainable community-wide prevention methods for cardiovascular disease, residents need help with managing their health appropriately. In order to change behaviors and to promote positive healthcare outcomes, according to Arnett, the prescription of exercise, a neighborhood environment for support, and access to facilities for physical activity should be assessed. And in Hillsboro, there is a YMCA, and there's also the senior center for older adults. Physical activity has immediate health benefits, reducing the risk of cardiovascular disease in older adults. That's why I chose chair yoga, since it's a low impact form of exercise that has been shown to improve the health of seniors. So the intervention was chair yoga for the older population. The location was the Highland County Senior Center, and in collaboration with one of the instructors from the YMCA for Silver Sneakers, her and I taught older adults the chair yoga program at the senior center. I distributed flyers at physicians' offices, local hospital, retail stores, and grocery stores. And then there were color handouts for the participants to take home to continue the exercises at home, and they were printed off by Southern State Community College, and they were color handouts that were donated for them. The expected outcome of the chair yoga program where the participants were going to give a return demonstration of the chair yoga exercise program there, and then verbalize the importance of continuing the physical exercise and reducing their risk of cardiovascular disease for the rest of their lives to implement a good program for themselves. The evaluation method, where the attendees completed an assessment tool, and that tool evaluated the level of confidence to repeat the exercises at home to see if they could do that by themselves or with someone helping them, and personal acknowledgement of the exercises as a health benefit. The participants verbalized that they enjoyed the yoga program and that with the color handouts, it would be easier to at least do part of the program, if not all of it, at home. Community health was promoted by implementing a physical activity program for them into the daily routine of an at risk program to maintain and improve cardiovascular health. Also, chair yoga has been shown to improve mental health in older adults through socialization and a feeling of community, so they can actually be together and be easier for them to continue the program. If they wanted to get together later at the senior center, they could do that or continue at home, maybe together with people that have participated together.